Hello everyone, my name is Andrew Blam, I'm the practice manager at Trenton Pet Hospital, and this is Dr. Ginny. We hope you are being safe as we are experiencing some very interesting weather here. I think most of the province is getting slammed some way. So hopefully you're indoors or safe at work. We have decided in our fourth installment of Coffee with a Veterinarian to talk about one of the things that we talk about as kind of a standard at Trenton Pet Hospital in any exam. It's kind of one of the foundation building blocks. There's so much information, misinformation, lots of things to get into. And that topic is oral health. So, we brush our teeth every day, and a lot of diseases and other things are linked to your oral health. So we want to make sure that as part of your preventive treatment and gold standard medicine that we provide at Trenton Pet Hospital, you are maybe thinking about some of these things. And Dr. Ginny has lots of information. And then I also have questions that have been submitted and ask you to as well submit them as we go, because I get them on my fancy iPad. So yes, off to Dr. Ginny, and we'll get started.
Well, hello everyone. I love teas, and I can talk about teas all day long, so Andrew may have to...
we'll cut you off.
may have to cut me off to make sure that I don't go deep into the woods. But let's talk teas. So what I have done, I kind of looked up what are the most common misconceptions and myths when it comes in dental care in our pets. And there are a few things, actually. I was surprised. The list was quite long. So let's debunk the myth, okay? So number one was pets don't need regular dental care. And I have to tell you, nowadays, I think pets more than ever need regular dental care. They need it to start as early as 4 to 6 months of age, if not earlier. And why do you want to do that? Well, because you do want your pet to be accustomed and to be comfortable with you brushing their teeth, touching their teeth, flipping their lips up, checking their teeth. The earlier you get it started, the more likely the pet is going to desensitize, and you will have an easier time to brush your pet's teeth or take other care of your pet's teeth, okay? Of course, we do have to realize that severe dental disease, just like in humans, will affect the pet in many different ways. If they can't chew properly, almost invariably, they probably will have some sort of dental disease. Cats may actually, if they cannot eat well, they actually will be more predisposed to have liver disease. The bacteria showering from their mouths can go into their heart, as well as it can go into their kidneys and liver, okay? So teas are very important to the whole overall health of your pet, okay? So let's talk a little bit about, well, what do we do, okay? We usually in exam rooms, when we talk to our clients and we have puppies or kittens, we already tell puppies and kittens, hey, you need to start getting them used to you in their mouths as early as 3-4 months of age, okay? Kittens are especially, I would say, right? Because not very many people can brush their cat's teeth. And why would you if that never has happened to them before? And a lot of times we get the recommendation, well, now we need to do something about your pet's teeth when there is already some degree of gingivitis already present. And when you have gingivitis on the mouth, and here I am telling you, hey, use this brush to brush your pet's teeth, well, it actually is painful. It will hurt. So you will actually, surprisingly, will hear me quite often to say, let's first clean up your pet's teeth. Let's first make sure the gum is healthy, make sure it's not inflamed, and then we're gonna start brushing your pet's teeth, because we do not want that negative association. You get the toothbrush, it's gonna hurt, okay? So the misnomer number 2, bad breath in pets is normal. Well, while I agree, pet's breath will never smell minty fresh. And it will be a little bit different smell than, for example, like, well, human.
It's not the
would be.
minty fresh you and I
Yeah,
breath.
exactly. It's gonna be, you know, a little bit different, right? But the breath should still be, like, the breath should not be horrible.
It should be tolerable.
It should be it should be good enough that you have no issues kissing your pet. Or when your pet sleeps in bed with you, you don't have to turn away from your pet's face because your horrendous smell coming from your pet's
Hi,
teeth.
Patricia.
So, I would say that if your pet has bad breath, almost invariably your pet has dental disease. We just need to figure it out how severe that dental disease is. Cats, even as young as 6 months of age, already can start gingivitis or inflammation of the gums. And they actually may need some support as early as kittenhood, okay? This is a big one. Chewing hard food or toys cleans teeth effectively. So there is a test, okay? And the test is whatever toy you have for your dog's teeth, if you hit your kneecap with that toy, just like that, and it hurts you, it's too hard for your dog's teeth. Way too hard. So what happens if your dog, for example, bites, unfortunately, into an antler? Antlers are very, very hard. So what happens? An antler doesn't give in. So what happens is one of the most common injuries we see, there will be actually a fracture of the carnassial tooth. But the way how it fractures, and I'll show you my handy dandy little model right here. I don't know if you can see it, okay? So the carnassial tooth we're talking about will be that tooth right here, one of the biggest teeth in a whole dog's mouth. And it will fracture parallel to the jaw. So you won't even see a fracture, okay? The fracture will be behind the front of the teeth. So a lot of times we don't even know that our pet has a fractured tooth, and we know something is going on because there will be a very heavy accumulation of the tartar and gum inflammation at that tooth, okay? So that's when, if such thing happens, majority of the time that tooth needs to be removed, needs to come out, okay? So again, if the toy you're buying your pet is too hard and it hurts you when you hit your knee, please don't give it to your pet. It's too hard for their teeth. So Kong, we do like Kongs.
It has give, but stay away from things like Nylabone.
Yes, Nylabone. I don't know if there is a lot. There is a huge variety. There is a huge variety in pet stores. So dogs they intended to choose the toys and break them, right? For some reason, we think that if the toy is demolished, then that toy is not good.
I always used to go into a store thinking, give me a toy that my dog can't break, so that I'm not constantly replacing it. Well, you know, come to find out, I could replace it 100 times over and save money than a pet breaking the tooth, you know, needing an extraction, requiring x-rays. So it's one of those things that, again, until you're seeing it every day, you know, I was ignorant to it. I had no idea. I just thought, well, they're enjoying it. And of course they enjoy it, right? Everything that they shouldn't, they absolutely love. So, and then I find even once they do start to give, they get sharp.
Yes. And
it cuts the gum. So you'll often see bleeding on the toy. That's an ultimate sign that it is not
good. No. Not good at all. So what about greenies, dentist sticks? So, greenies and dentist sticks, I would say on one hand, yes, I would say they are good for the teeth and they give under the chewing. The problem I have with them, they're very, very high in fat. And that's what, like one greenie for a large breed dog probably will be 150 calories. Considering your big 30-kilogram dog should be eating approximately 1,300 calories a day.
It's like us eating a donut, right? And
Yeah.
there are options for it. And if you are going to give them, you just have to take it into consideration.
Exactly. You need to take it into consideration, especially if your pet is on a weight maintenance diet, okay? And there are pretty much no really chewables available for cats. Cats do not like really
Cats
to
always
chew.
get the
Yeah.
crap end of the stick.
Yeah, they really do. They really do. So I hope that kind of helps you to figure it out, what's the best way to choose the best type of toy for your pet. And I would definitely be very careful with dentist sticks, very careful with the greenies. Greenies and dentist sticks are also very high in fat, and that's concerning because in small dogs, Shih Tzus, Chihuahuas, etc., they actually have been linked to causing pancreatitis, inflammation of the pancreas. Our pet's pancreas is simply not equipped to deal with the amount of fat which is those chewables are consist of. And they have to be, because to keep that shape, right? To keep the shape, they have to have a lot of carbohydrates and a lot of fatty type of substances to keep the shape together. So another misconception is, if my pet is eating, the teeth must be fine. And I would say this is a sad reality when it comes to our pets. They do not show us pain at all. Sometimes if you are observant, you may notice that all of a sudden your pet is eating only on one side, or maybe they're very careful at picking their food, not like before, or maybe they just swallow it. So instead of chewing the food, they actually swallowing. Another sign of something is going on when it comes to oral health, if they're messy eaters. All of a sudden they became very messy eaters. So there is lots of kibbles around, they're broken up kibbles, or they puke. They puked untouched kibbles, right? Or the kibbles haven't been broken, they haven't been chewed, and they puke, right? So that's kind of all the symptoms. Something is going on in your pet's mouth. Not a bad idea to check it out. Okay, so there is quite a few instances where pets' teeth are bad enough, they do need to be removed. And a lot of people then worry, well, how is my pet gonna eat? Well, surprise, surprise, they're gonna eat better, okay? They're gonna eat better because there is no pain, right? If there is no pain, they're more likely to eat. In fact, they're actually even gonna gum it down, right? They will still, they're actually more likely to go back to their normal chewing behavior. Even though they don't have teeth, they still will try to digest the food or start to digest the food in the mouth as it's supposed to be. The cats have a very specific type of disease, feline eosinophilic stomatitis, which is immune-mediated condition where their own immune system, for whatever reason, starts to attack their teeth enamel. And when that happens, the gums get really, really, really red, swollen, decaying. Like the smell is overwhelming. Yeah, you literally know when your cat came into the room because it clears that room.
Yeah.
That room. So a lot of times the only solution for this particular condition is remove all the teeth, remove them all, okay? And we do it in a few stages, but the fact is eventually your cat will have no teeth left. And guess what? Those cats do so much better. All of a sudden, once the gums are all healed, while the pain is away, they eat. They're back to normal to eat. Their kidney values improve. They're happier, they jump, they do all those things their pet owners forgot that they used to do because there is no pain.
And there's options. I mean, clearly, feeding both wet and dry is preferable, but there's wet food. We're often talking about maybe, adding a little bit of water to your kibble to soften some of the food if it's really needed. But like Dr. Denny says, you go from a pet with a mouth that's sore and, they're just trying to eat because they know they have to, and they're hungry to, now they have no teeth or maybe only half of their teeth, but they feel great. They're going to chow down on it. So a huge difference in these pets.
They're going to eat much, much better. So talking about dry food versus canned food, okay? There is a very, very common myth, especially cats, that they need to eat soft food because that improves their bladder health. So there is a little bit of truth in it, but not because of the soft food, but because of the fluid intake. There is a difference, okay? The reason why we used to, many years ago, do recommend a lot of soft food is because soft food obviously contains a lot of moisture, and in cats it was very important that they have a lot of moisture so they can pee out a lot, less chances of developing crystals, or if they have any crystals, they will be flushing them out of the bladder, okay? Nowadays, with progression of quality of the diets, what's available, it's not necessarily anymore. A lot of foods for cats are formulated in such a way, and by a lot, I would say reputable brands, okay? Developed in such a way that they reduce the chance of cats developing crystals, okay? They still need to pee, drink a lot and pee a lot, but I recommend achieving that by getting them, excuse me, by getting them fountains, drinking fountains. Did you notice how your cat loves running water, right? Some cats just wait for you. They will not drink from anywhere else, but just wait for you to be in a bathroom, open your tap,
and
right?
we transitioned one of our cats from sink drinking to we used a Catit fountain. It's C-A-T-I-T. You can find them on Amazon, and they have filters. But you know, you started on the counter where the cat is looking for the water with the fountain, easily was loving the running water, and you don't even hear it, to then moving it to the floor and then to a more appropriate place than your counter. And now that's all my cat is on.
Yeah. So my suggestion is to stay away from a plastic type of fountains. The reason for that is some cats, not all, but some cats can actually develop the contact dermatitis. So what that is they actually may have inflamed chin just by the contact with the plastic when they drink the water. So I would say stainless steel probably would be a much better option. The cost, I think Catit.
Well, I looked them up. Catit makes the stainless steel ones, and they're about $50. I think there's a couple of different sizes, and you don't need, you know, unless you have a multi-cat household, you don't need a ton of water in there because you still want to change it regularly. It's just to get the water moving.
Absolutely, absolutely. So that fountains are an absolutely fantastic alternative to using a canned food. Not to mention, it will save you quite a bit of money not to feed
unless
your
you have
cat
a demanding cat who's demanding their wet food.
Yeah, there is some medical conditions. There are some medical conditions we will feed with a canned food. So when a cat or a dog, when it's a kittenhood or puppyhood, we do recommend to offer canned food just so they know the taste and just so they like it. So if there is any medical conditions and we do need to feed them with a canned food, we're not going to have too much resistance about that, okay? So usually around 6 months of age, I would tell my clients, this is a good time to stop feeding canned food, okay? So I do want to touch on anesthesia-free dentistry.
Talking about that this morning.
Anesthesia-free dentistry. So it came to Ontario, and we do sometimes see people, you know, telling in the exam rooms, they would tell me, oh yeah, my dog had their teeth cleaned. It's like, oh really? Because we don't see medical records. Well, in the pet store, they had the anesthesia.
The traveling cleaner.
The traveling cleaning.
It was $325.
And it was $325. So I do want to talk about that, okay? So imagine having this in your mouth.
So you can see that side of the model's all red and inflamed. You
can see how red and super inflamed the gums are, how much tartar buildup there is. So
that's assuming no fractures or toothaches.
Yes.
If you've ever had one of those, it's
so
unbearable.
Imagine holding down your dog, whoever holds down your dog, to clean that, right, and touching the gum. Just imagine that, scraping.
We're not even going to talk about the fact that they're not getting underneath the gum line.
we are going to talk about that.
Well, in terms of the pain level.
Yeah, okay. So if your pet has any gingivitis, and somebody goes there and scrapes the gingivitis so the teeth look white, because there is nothing they can do about gingiva. The only thing this service can do, make the teeth look white, if that's even possible. And you afterwards will try to brush your pet's teeth. Well, guess who's gonna get bitten? And if you not get bitten, your pet is very, very sweet and nice.
Very nice, yeah.
They love you, okay? Because that is an extremely painful thing to do, okay? So that's just simple, fear-free, like...
That's just basic.
That's just basic.
That's basic.
Okay? So let's say that this has happened and people did scrape off all the brown stuff. The fact is that they cannot go under the gum line because they have no training, okay? Well, they probably don't have tools, and I mean any sane pet, unless it's dead, will not allow you to do that, okay? So all the bacteria, all the plaque, all the tartar is left underneath the gum line. So literally the only effect you got is white teeth. That is it. There was no treatment done at all to prevent further plaque accumulation, tartar accumulation, and gum healing. Not only that, but the instruments, most of the people who offer this service have zero, absolutely zero training in animal anatomy, husbandry, medicine.
My first question was, where are these tools being sterilized?
Well, yeah, that too.
That was, you know.
Yeah, that too. How's it being sterilized? Where? But you say tracking me. What was it? Is it tracking me?
Well, the level of knowledge, they have no
Yeah.
background or training on this type of
Oh,
thing.
I remember. Because they do not have the training, there is a special way, like they actually get trained in a vet tech school or in a veterinary school. You actually get trained how to properly use those tools. The angles you use those tools, different tools for different teeth, for different services of the teeth. And because usually people who offer the service have zero training when it comes from a reputable sources like veterinary colleges or veterinary technician colleges, they just scrape it. Well, what happens if you scrape? You actually scrape the enamel of the tooth itself, right? And by scraping the enamel of the tooth itself, like doing those microfractures, you're actually speeding up, you're making the surface porous enough that more plaque and more tartar will accumulate faster.
Plus, the pet is not, you know, under anesthetic, so it may be struggling, yeah.
Yeah, so the
Not a
proper
good idea.
dental cleaning in a pet always includes general anesthesia.
So how do we do it? What is the process?
That's a very good question. So the proper process always includes general anesthesia and the full mouth x-rays. Why do we do full mouth x-rays? Because tremendous amount of diseases and problems lie underneath the gum. Quite often we can have a healthy-ish looking gum. We do full mouth x-rays and all of a sudden, boom, the tooth is missing there. Of that tooth has fallen out. It has only the root, which we need to go and dig it out. Or there is some other pathologies of the mouth. So once the pet is underneath and under the anesthesia, then the technician will properly scale and clean every single tooth, including underneath the gum line. So now that they have removed that film of whatever debris from underneath the gum line can actually reattach to the tooth. But if you do not remove that film of plaque and garbage, right, then the gum line will never have even an opportunity to get reattached to the tooth, again, okay? So, but let's talk a little, I think it's good to know, like, what does happen during.
And I mean, we offer two-stage extraction,
Yeah.
well, sorry, two-stage dentals at Trenton Pet Hospital. And I mean, there are pets who come in and like Dr. Ginny says, you do the cleaning and there may be, an x-ray that uncovers things that we didn't otherwise know, or it could be absolutely fine. There was
Yeah.
nothing on the x-ray, it was great. the cleaning is done, no further action required other than your typical maintenance, which we go over. But it could be a case where, like we were talking about earlier, it could be extractions, full mouth extractions. So we do it in 2 different steps. That's for budgeting purposes. It's, it's fear-free. It's also, just better for the pet, less stress. And it also gives us a better idea of what we're going into when the pet is going in for the extraction. We already have looked at these x-rays. Dr. Ginny has already made a plan, So there's a number of different benefits. I think for anybody who's even slightly concerned or interested, I mean, our dental consultations are free, they're complimentary, but they're also included in all of our annual exams, or we're always talking about that type of thing. It's sort of one of those checklist items. It's just sort of the building block foundations. So there's a lot that goes into it. Every pet is different. The species are different. The conditions are different. There's pets who are already fearful, and for example, I've had a dog before that's had a broken tooth, and it made him aggressive, right? So, those are not things that we want to delay either, and there is a real cost. So that goes back to things like insurance, and some insurances do cover it, and we can kind of get into that. But, it's not something that I think that we take it seriously enough. I think pet parents kind of think, well, it's my dog's teeth and, oral health, and maybe the breath smells a bit, but again, they're not really going to show us those signs. So they could be silently suffering. It could be affecting slowly other organs, not to mention they're not getting the proper nutrition, just their quality of life, right? And like I said before, if you ever had a toothache or any type of, canker or oral sore or anything like that, it's painful. It's distracting. That's all you can really focus on. So, just give it a second thought. We can look. I mean, ultimately, I've always said to people, we don't have x-ray goggles. So really, to know what's going on, you need x-rays. And almost every pet needs a dental cleaning at this point. If you haven't had it in the last year or so, it's, all of mine have had it, probably within the last year. And I already can look at their teeth going, they need to go in again. They need to, to get some fresh update, because we're going in once or twice a year. But there are products in the meantime.
Yeah.
And I mean, that doesn't mean like, yes, is the ultimate goal you could brush your pet's teeth? I think so. That would be phenomenal.
That would be phenomenal.
But there's some reality to that as well, right? Especially a pet who you haven't desensitized or started from scratch. So maybe you could talk about some of the products, or and this isn't even Trenton Pet Hospital specific. There are other things out there that aren't this, but these are some of the things that we carry in-house.
So when it comes to products, one of the things I want to talk about, that there are products who have been actually submitted to the VOHC certification. So what that means is those products have been tested, and they actually have been shown that there will be a difference when you use those products versus when you do not. So the stamp looks like that. I don't know if you can see it, and it will say VOHC, okay? So those are the products which, in my humble opinion, I definitely would take preference over other products, okay? So they actually have been tested, they do make a difference. So a little bit about anatomy of the plaque. So it takes 3 days for a plaque to become tartar. So plaque is that white stuff on your teeth, okay? So if you take, I don't know, like if you take
your
Kleenex,
sleeve and go like that.
The stuff which it is will be left on the Kleenex from your pet or yourself. That's actually called plaque. And if that plaque is allowed to stay on the teeth for longer than 2 days, I would say, the 3rd day, it becomes tartar. Tartar is that black stuff, okay? With enough, so that black stuff is called tartar. With enough accumulation of that tartar, it starts to pushing up on the gum line, okay? And what it does, it starts ripping out the gum tissue from the surface of the tooth. And as you can imagine, this is a very painful process. Gum gets very, very inflamed, and bacteria jumps in there, and that's when the smell.
And what's that called?
Yeah. And that's when the smell comes. Your dog smells, or your cat really smells, okay? So there are a few things we would suggest. When they are puppies and kittens, something like a very soft bristle toothbrush is a great idea, right? And you don't have to, like when they are babies and there isn't really a lot to do, all you want to do just to get them used to the sensation of you, like doing something with their teeth. I just came up, I was wondering, some feeding mats.
Yes.
Right?
Yeah.
You can put some peanut butter, if there is no peanut butter sensitive people in the household, you can put it onto the wall, and as your pet licking that peanut butter, you can actually brush their teeth. Okay? I know it kind of sounds funny, but it will keep your pet preoccupied while you are doing something which is good for them. Now, you do not need to open your dog's mouth or your cat's mouth. You don't need to worry about inside of the teeth. All you have to worry about is outside portion of the teeth. That's all you have to do, okay? So, and I'll show you.
And I always will give it to them. It's like the nail trimmers. I'll let them smell it. I'll let them see it. I'll let them touch it, right?
Absolutely.
You're not just...
So I do get a lot of questions. Well, do they need a toothpaste? No, they don't. They actually do not need toothpaste. In fact, some toothpaste, especially with fluoride, will be toxic to your pet. So don't use toothpaste. You just need water and the abrasion of the toothbrush. And I'm gonna go on the right side. And what you need to do, like literally, very gently. In a perfect world, you will brush your teeth from the gum line down, just like that. From gum line down. Okay, or on the lower teeth, from the gum line up on the lower teeth. Okay, just like that. In a perfect, don't worry about opening your pet's teeth and doing this or doing that. Don't worry about it. All you have to do, from a gum line down or from the gum line up. Okay, and what you're doing, you're pretty much removing that plaque. Okay, if you do it even every other day, it would be absolutely great. Every other day, okay? If you're seeing some tartar, don't worry about trying to get it out. You can't. You will damage the enamel if you are trying, and not to mention you will damage the gum itself, the gum tissue. Don't worry about it, leave it alone. The trick is not to let more tartar build up, okay? So for our cats or pets who you cannot do that, like you can't do that, they will eat you. We have an alternative. We have those nifty wipes, okay? Nifty wipes by Decra, okay? And what they are, you pretty much, instead of Kleenex, you pretty much use those wipes. Which
looks like a Lysol wipe.
Yeah, looks like a Lysol wipe, and you're just wiping the teeth.
And there's no flavor to it. So they're not, icked out. There's no alcoholic kind of smell or anything repulsive.
Exactly. So I'm going to, disclaimers, are not going to be as effective as brushing teeth, but still better than doing nothing when it comes to taking care of the teeth, okay? There is lots and lots and lots of things like additives to the water. There is lots of those. There is Veterinarian. There is different companies come up with their own. Again, those are mostly to reduce the amount of bacteria in the mouth, okay? Less bacteria, less inflammation of the gum tissue, slowing down the gum disease, not to mention does make your pet's breath a little bit better.
But like you say, it's slowing it down. It is not stopping.
No, it will not stop it. It will slow it down, okay? There are lots of chews available, okay? On the market, we carry Vorbag, just not for the special reason. We do believe in the brand. We like it. My own dog chews that, okay? And we find that, keeps them busy. It's good for them. It is high in fat. I'm going to tell you right now.
You have to calculate it. Ask us to calculate it. So what we'll do is we'll take into consideration, say you're giving 1 or 2 of these a day, hopefully only 1, and maybe not every day. And we'll plug it into the feeding calculator. So all these companies have feeding calculators online, and we'll plug it in so that we know if you are feeding Fluffy one of these chews and you're, you know, typically giving, and it's all done in calories, and you're typically giving the equivalent to, you know, 2.5 cups of food. Now you have to go down to 2 cups of food, for example, as a rough estimate, so that we're not overfeeding. And in a lot of these scales, when you're looking, most pets, unless they are some type of running, what are those quick racing dogs, like a whippet or something
Greyhounds.
like that, even the large breed, you know, active dogs are actually low energy, so they should technically, you know, all be considered that. So you just have to take that kind of thing into consideration when you're adding. And I mean, you know, like we were talking about the certification and stuff like that, you're not going to find that on things like, you know, dentist sticks, and, you know, that stuff is,
yeah,
that's commercial stuff, right?
I would say it's commercial stuff. A lot of it is commercial. I cannot say enough amazing things about dental formulas. We work with 2 big companies. We work with Royal Canin and Health Science Diet, and their dental formulas are number 2 after teeth brushing. Okay, number 2. If you cannot brush your pet's teeth, dental formula will do the trick. So the kibbles are quite big. You will see that they are much larger in size than the normal kibble. And there is a specific way how it's made. The matrix is such that in order for pet to break down the kibble, they need to chew it twice. So you need to have 2 bites in one kibble for the kibble to break down, effectively removing the plaque. And I can't tell you how many times in exam rooms we will open a dog or a cat's mouth, and we will know right away if they are eating dental, Royal Canin Dental, or Hill's TD diet.
Well, if you cut it in half and look, it actually looks like it's got like a grid in it, or like tubules or tunnels or something that is to scrape along to get. But again, that's number 2. It's still number 2, but it's.
I do have to say that there is oral care in pet stores. It is not the same. Matrix is not the same as would be in prescription diets. And contrary to popular belief, I would say the prices are extremely compatible, whether you're doing the Royal Canin in a clinic dental formula, or whether you're buying Royal Canin oral care in a pet store. I wouldn't be surprised.
And they've done that on purpose.
Yeah, I wouldn't be surprised if the price is going to be very, very, very similar. Okay, so in a healthy adult maintenance, in a healthy pet, in my humble opinion, adult maintenance diet should be dental formula. In fact, we stopped carrying other diets simply because there is absolutely no reason to feed, you know, adult formulas and anything when you can do that. So
to break it down, I think, because this is kind of how I looked at it, if your pet is not on a gastro type of diet, or, you know, even could be a urinary, anything that is a special diet for their health that's recommended by the veterinarian, the go-to default is dental.
Absolutely. Absolutely dental. So we do have a little special, right, with a Hill's TD. Why don't you tell me that?
We have a number of things right now. Number 1, so for anybody who's come in to Trenton Pet Hospital and they've, you know, you've booked your dental with your pet, we will send you home before and get you started with the Hill's TD dental food. So you get a small bag. And then also you get another bag that has a toothbrush, and within that bag you also have 2 coupons. So if you get them right now, they are February and March, and each of those coupons is, I believe it's either $30 or 30% off if you order that food on the web store. The reason I say we are doing this before the actual procedure is because right after the procedure, we are sending you home with some soft food, because there will be some recovery period to that. There are also a number of sort of dental related deals, but can also be taken advantage of with the dental food. So any client who goes onto our web store, so if you just go to our website, you'll see online store. It takes you to a third party, and they have all of the same stock as us, all of the same diets. And if your pet needs a prescription, we verify that prescription. It all gets shipped to home, nothing gets shipped to clinic. And if you do an auto order, not only do they give you, I believe it's 5%
5%,
off,
yeah.
they have it right now where your first 2 auto orders, you will get an additional 25. Again, it's either dollars or percent. These just came out yesterday. So there's a number of deals that are going on. Again, just message us. Even if you were on it, you can take advantage of certain deals. There's deals for analergenic. And I mean, this food is not cheap. And like I've said before, this is not how we make our money. So we're passing along the savings as well. And we understand that it's important. We understand that it has a real cost to it. So give us a call or, send us a message on Facebook or whatever and see if there's anything that you could be taking advantage of. And I'll go as far as saying, if you are a client at Trenton Pet Hospital, one of the first things we do is set you up on the web store, and we will favorite your pet's food based on whatever Dr. Ginny's recommendation would be. And again, we do that because we feel it's one of the foundation building blocks of, that gold standard medicine, the proper, proper health. And it's also, it's just easy, I think as the world changes, less and less clinics and retail spaces are holding inventory. And that's because of cost, right? They're shipping it here, then you'd have to come and pick it up. And if I don't have to leave my house and I can have it shipped right to me, I will take advantage of that. They've lowered their prices on the web store. So now it's $5 flat rate shipping, which is amazing. Goes right to your door. And I think it's Pure Later or Canada Post. So you don't have to leave in this type of weather. The auto order means you don't even have to think twice about it. Mine is set for every 5 weeks. It just shows up. So not only am I saving on the auto order, I am also saving so we give you a 5% if you have an auto order, but then the manufacturer is giving you that additional 5%. So you're saving 10% of what you would have saved. Like, it's a no-brainer. So we try and make it easy. Ask us about it. We will get you set up. We will go even as far as calculating based on your pet's breed and weight, the amount of calories. So we shouldn't be measuring in cups because my cup is different from your cup and different from your cup. So we go by weight. So we even have little scales here that are cheap. And we weigh the food, right? So it's going by calories, it's going by weight. We will calculate all of that for you. Whether your pet needs to lose weight or it's just a regular standard feeding, we will do that for you.
Just give us a little bit of time. I know that...
Give us a heads up.
Yeah, give us a heads up or email it to us. Or if you came for an appointment, we do need a couple days after the appointment to get back. Just, we put it on our work list and we will email you the exact amount of grams you need to feed your pet, okay? So I think those are all wonderful. I hope our discussion was helpful. I hope that we have covered the most important parts of keeping your pet's health, dental health well. I strongly believe, my strong belief is that if you brush your pet's teeth every other day, if you feed them dental formula, you will prolong your pet's teeth twice at least, as long as if your pet receives zero help, okay?
And we even have a sign that we refer to, it's in our treatment room. Every tooth is a patient.
Yes.
So every single tooth is important. And again, the consultations are complimentary. I mean, it's regularly part of our wellnesses. We're going to be looking at that type of thing. But if it's something you're interested in, it's even piqued your interest, you want to get some pricing, just find out some best practices, give us a call, send us a message, and we'll get you hooked up. We'll get you fixed up.
Absolutely, absolutely. And one of the things I always believe is aftercare. So let's say your pet came in and had its teeth cleaned. That's not
where it ends.
This is not where it ends, okay? We need to set you up with plan, right? The plan is, can you brush your pet's teeth? Yes or no? Well, can your pet eat this food? Yes or no, right? So we try to explore all the other options for your pet to keep its pearly whites.
Absolutely. I mean, I would like to keep my own, and there's not dentures for, maybe there are dentures for dogs. I think there actually are implants for dogs.
I think there are implants for dogs nowadays.
We are thankful for you guys joining us. Hopefully you can share these posts as well, because the more information, it doesn't have to be Trenton Pet Hospital clients, just the more general information that gets shared around, the better. And our next, I think number 5 is going to be kind of a sensitive topic that we've chosen, but it's something that's near and dear, I think, to all of us in this profession, whether you're working at Trenton Pet Hospital or any other clinic. We are going to be talking about mental health, keyboard warriors, online, reviews, things that sort of can get out of hand. And it could be a bit controversial, but we want to at least give an insider's view sometimes on what's going on. Again, debunk some myths, but give you some perspective. So thank you again for joining us. Please watch for our next one. Again, it'll be in 2 weeks. I believe that is the 7th of February at 12 o'clock.
Thank you so much, guys. See you in 2 weeks.
Thank you.